Okay. Oops, sorry. So I'm going to start the talk now. So as I mentioned before, my name is Kyra De Coninck, and I'm the Director of Education in the School of Sport and Exercise Sciences. And I'm also a lecturer on the Sports Therapy and Rehabilitation program. So what I want to talk to you about today is the program itself, the kind of subjects and the modules that you will be covering. And also, I want to also talk to you about chronic pain, which is a very puzzling and very important topic for in sports rehabilitation. But I'll talk more about that in a moment. So really, sports therapy and rehabilitation trains you to become a sports rehabilitator. You can also be a sports therapist as well with this degree, which I'll explain how to do that in a little bit. But we are accredited by BASRAT, which is the British Association of Sports Rehabilitation and Training. Trainers, sorry. Sports therapy and sports rehabilitation are basically the same profession, but they are accredited by two different professional bodies. So this is why we used to be accredited by the Society of Sports Therapists and then decided to switch over to BASRAT. There's nothing wrong with the Society of Sports Therapy, but we felt that the future is really in sports rehabilitation, whereby we can see that the industry and the market is going to be offering a lot more possibilities in terms of employment and professional development in sports rehabilitation, both for athletes, but particularly within the community and within specific clinical populations. So first of all, you're going to be learning anatomy. Anatomy and physiology are going to be the bedrock of your education. With the help of that anatomy and physiology, you will also be learning how to diagnose injuries, how to treat them, and how to manage them. That's one strand of the program. The second strand is not just how to treat injuries, acute injuries, but also how to rehabilitate injuries, both acute ones and chronic conditions. So that is really about how to use exercise as medicine for a wide range of people. So you will be taking part in different placements throughout your program. And some of those placements will be with us in the clinic at the university on the Canterbury campus. Some of them will be with sports teams, maybe on the Canterbury campus, maybe there'll be a local sports team, or maybe it could be a sports team close to where you live. You can arrange placements yourself, and we will help you with finding placements as well. The other strand, the other subject area is sports massage, which you will be taught in the first year. You will then go on to do more advanced neuromuscular techniques in the second year. And then in the third year, you put everything together and you will be using sports massage as one of your treatment tools in your toolkit. You'll be learning about how sports injuries occur, the mechanisms of sports injuries, and also whether which injuries are most likely to occur, which ones are less likely to occur, and so on. You will also learn which injuries you can treat yourself as a sports rehabilitator, and then which injuries you need to refer. Either you need to call the emergency services, or you need to refer them to a specialist or to the doctor. So you will be very clearly be learning where your professional remit and where your boundaries are. Injury examination and assessment. So this is where you learn how to assess every single joint of the body. If you can imagine, a client comes to see you in your clinic with a painful ankle or a painful shoulder, you need to know where to start. So you will learn how to assess whether this is a muscle injury, whether this is likely to be a joint or a ligament injury, whether this is a trapped nerve, or whichever injury it is. So you will learn how to differentiate between these different types of injuries. Rehabilitation. So rehabilitation is really about using exercise. It uses the principles of strength and conditioning and applies those to an injured population. You will also be using taping, electrotherapy, using ultrasound, and using interferential, using laser treatment to treat injuries. And you will be learning joint mobilizations. So if any of you have ever been to a chiropractor or an osteopath, these are the professions which use joint mobilizations a lot. You'll be learning a very gentle version of these techniques, so that again, if the capsule around a joint is very stiff, or the ligaments around a joint are bound up with scar tissue, or very stiff, it's very difficult for the person to move their joint, you will learn how to mobilize both the spine and the peripheral joints, the joints in your arms and in your legs. You will also be learning about research methods, and this is really important so that you can interact with research, so that you can make sense of research, so that you can differentiate between good science and bad science. You will learn about injury prevention. This is something that we will teach you in the final year, and this is different. You will learn about different programs in how to prevent injuries. This is both for sport teams and the general population. Then in your final year, you will take part in a research study, which could be rehabilitation based. It could be something to do with a particular injury or a particular issue, and we will guide you for your research study topic nearer the time when in your second year. And then in your final year, there is also a placement module. And this is a module whereby you will be reflecting on your placement. We will be guiding you in how to get the best out of your placement, and we will be liaising with your placement supervisor. So this is just to give you an overview of the different modules that you are going to be taught in your first and in your second year and in your third year. Broadly speaking, anatomy and physiology does run all the way through, but the real focus is going to be in your first year. So this is where you are going to look at anatomy and biomechanics, but you will also be learning about physiology, which is the function of different body systems. In your 3 years, you will get sports therapy and rehabilitation skills. You are taught these skills throughout your 3 years. And each year we will just, you will use your understanding and your knowledge and the application of the skills that you've learned in the previous year. So you're gradually building up your toolkit. In your first year, you're going to be learning about peripheral joint assessment, where you learn how to assess the shoulder, the knee, the hip, the ankle, and so on. You will also be taught sports and remedial massage and mechanisms of sports injury. So this is how do injuries occur. In the second year is really focused on rehabilitation. So that's where you take all of these principles here and apply them using exercise. So of course you need to know your anatomy in order to understand which type of exercises you would want to prescribe for, say, a grade 1 ACL, or a very mild lower back pain, or something like that. So those are the principles. So you will learn how to construct an exercise program for somebody whose injury is mainly muscular based, or somebody whose injury is mainly ligament based or tendon based. And there are different principles that you need to use. Then further down the line, in the spring term, in the second year, you'll learn applied rehabilitation, which is really about putting the program into practice. Learning how to regress, how to make exercises easier, how to progress, how to make them more challenging. You will also be learning therapeutic modalities, and that's really where you learn about taping, where you learn about aquatic therapy, where you'll be learning about mobilizations and electrotherapy, and soft tissue techniques, which are neuromuscular techniques, which is advanced sports massage. Then in your final year, you'll have a placement module. There'll also be advances in sports rehabilitation, where you're going to be looking at what's the future of sports rehabilitation. So a little bit more about research and how you can apply findings in research in clinical practice with your clients and with your patients. And then again, injury prevention. So psychology, the psychology of injuries is very, very important. And we have a dedicated module for that in your second year, where you will learn how the mindset and how the emotional response to adversity or to injury can really differ. So you could have two athletes with exactly the same injury, say a wrist sprain, but their healing process is quite different. And that would be mainly because of the psychological makeup of these two people. Excuse me. So actually understanding how our minds and how our emotions can affect the healing process is really important. We don't train you to be a counselor, we don't train you to be a sports psychologist, but understanding these principles and knowing what the red flags are. So understanding when somebody is very reluctant to do the exercises, or when somebody is not doing the exercises but is still very keen to get back to their sport. So these are all kind of different types of behavior which we understand and which as sports rehabilitators we can deal with. And it's also about being able to recognize much more serious conditions which would need the help of a trained psychologist. And then the orange column is all about training, strength and conditioning. So first of all, the research in sport and exercise sciences is going to be a module in your first year which straddles both the research and the training aspect. So you're going to be combining both of those in one module. In the second year, it's going to be a module more in depth about research methods, design, and planning, which is really, you spend your second year in studying research methods and then putting together your own project. We give you broad topic areas, and then together with a dedicated supervisor, you put together your research proposal, which then in the third year, you conduct your own research project. And you can either do that on your own, or you can do that in a group. So that's the research study. And the professional development and placement module is in here as well, because of course that's about how to get the most out of your placement. These are some of the examples of some of our facilities. As you know, we will be based on the Canterbury campus. The picture on the right here is our current sports injury clinic. We will be having exactly the same facilities, both for teaching and a public facing clinic, where you can do your placement in your second and your third year on the Canterbury campus. This is our rehabilitation gym, and again, we will have a rehabilitation gym on the Canterbury campus. We also have access to all the strength and conditioning facilities at Kent Sport as well. And I just want to highlight one piece of kit here on the left, which is this strange looking treadmill, which is our zero gravity treadmill. So this is a piece of kit which we can use, and we can start people getting back to cardiovascular fitness, even though they may not be able to do weight-bearing exercises. So this reduces the amount of weight that is pulled through gravity through people's joints. So for example, if you can imagine somebody's had knee surgery, they may not be able to run in normal conditions, but on this treadmill they can run, because we can get that down to 0% body weight, so that no weight is going through their joints, but they can still get their cardiovascular fitness back. And the way that works, I don't know if you can see it, but there's this sort of bag around here that people get zipped in, and air pressure kind of lifts you off the treadmill, or lifts your body weight off the treadmill. So it's a little bit like running on clouds, if you can imagine that. And here is some more of our strength and conditioning equipment. Sorry. Okay. I just wanted to give you an example of one of the topic areas which actually runs through the whole of your program. So it's not because you have one module in your first year that then once you pass that module, it's over and done with and that's ticked off, because Sports rehabilitation is the type of degree where you're constantly building up your practical skills. You will need the theory to underpin those practical skills, but it's a very practice-based degree. So in your first year, you're going to learn the basics of sports and remedial massage. If you have already learned massage, or you're already learning massage at school or college, you will recognize some of the techniques, but we will also you will also be taught other techniques which you probably won't have learned in school or in college. So for example, soft tissue release and other techniques are taught within your first year. It's also a great way to try and learn your anatomy and to try and understand where these muscles attach, what their action is, and what they're called, because you'll be literally feeling those muscles as you're massaging them. So it's kind of learning by doing. In your second year, there'll be the soft tissue techniques module, and that's a more specialized, more advanced massage module where you learn neuromuscular techniques, myofascial release, you will learn kinesiotaping. So there's a whole host of other techniques that you're going to be learning to build on your basic sports massage techniques. Of course, you'll be able to put those in practice in your placement. And then again in year 2 and year 3, you'll have your placement at the University Sports Clinic and external placements with clubs and organizations. That's a video, but I don't know. You want to see the video? Okay, I'll play the video. I'd forgotten that there was a video here just to show you. So these are the hamstrings. Okay, oops, sorry. So that's just an example of a class. You could see the feet and the legs of some of the students observing. So this is typically what happens in a practical class, is that your lecturer, that was me in this example, is demonstrating a particular technique, and then you practice those techniques on each other. And then the lecturer, and sometimes we have an assistant or we have 2 lecturers. If the group is large, then we come round and we give you feedback. And then we will come round again and just make sure that you've understood the feedback and that you've adapted if you needed to adapt the technique. And of course, people are different, depending on people's levels of flexibility, depending on their pain threshold, depending on a whole host of different factors, you would want to adapt the technique. And this is incredibly important, that you learn how to listen to your clients and that you learn how to adapt different techniques. So in general, we have around between 15 and 16 students in a practical group. And of course, we've had to reduce that a lot during COVID. If we still need to work with social distancing in when you come and join us, we hope that won't be the case. But if so, then of course we have much smaller groups. Then we will have groups of 12 students. But hopefully we'll be back to a more normal learning and teaching and learning environment. So these are just some photographs of students that we took to different events, and some of them on their placement. So I just wanted to show you that sports therapy and rehabilitation is not just about learning in the classroom. So we have different marathons, different races. This was one marathon in Folkestone, and I promised the students afterwards we would have fish and chips on the beach. So that's all of us doing that. And then, of course, these are the students waiting, because some of these events go on for a long time. So we take a large group of students with us who then take it in turns to treat the athletes. And here you can see this was a running event. You can see here the runners are queuing up in order to get their post-race massage. So learning these techniques and learning how to be a sports rehabilitator in the classroom is one thing. You are all probably relatively healthy, uninjured individuals, and actually working with people who have just pushed their body to the absolute limit, or working with somebody who has just competed or has just completed some training is a completely different ballgame. And that's why coming to placements, doing placements, or coming to events is such an important part of your learning, so that you don't just learn in the classroom, but you learn in a real world setting as well. So what can you do with this degree after you qualify? Well, our students go into a whole range of professions. And of course, many of them become a graduate sports rehabilitator. And these roles are present in the NHS, in a hospital setting, or in a community setting, in the armed forces, with sports teams, or in a private clinic as a self-employed graduate sports rehabilitator. Most of our students do a combination of different roles, particularly in the early days of their career. You can also be a graduate sports therapist, again, working with sports teams and working as a self-employed sports therapist. You would then probably become a member of a different organization. And if this is something, if you are more interested in clinic-based work, then you might be interested in that, and we can help you to become a member of a sports therapy organization. You can also be a physiotherapy technician. That would be, again, in a community setting or in a hospital setting. A rehabilitation specialist gym instructor in private practice, or in community care, sports massage therapist, and then other graduate careers in teaching and sport development, in local government, administration, business, charities, medical device companies, non-governmental organizations, so again, charities, or public service organizations. So our students go into a whole range of different organizations if, after the degree, they decide, you know what, sports therapy and rehab is not really what I want to do. I want to do something else, and I want to help people in a different way, or I want to develop my career in a different direction. You will still have a degree, which means that you will be able to demonstrate to employers that you can think critically, that you are independent, that you are reliable, that you've developed as a person. And this is as important as learning about anatomy, as learning how to pass the modules and so on. It's your development, your personal development as an individual. So before I move to the second part of the talk, I just wanted to see whether anybody had any questions. But I think what I need to do is I need to stop the share.
You've got one there.
Would you be sports therapy qualified after the course? Yeah, really good question. Yes. So as I mentioned before, sports therapy and sports rehabilitation are basically the same profession. We decided to become accredited by the Sports Rehabilitation Organization because we strongly feel that in the future, the use of exercise as medicine is going to be really important in a whole host of different areas in healthcare. There are sports therapy professional organizations that you will be able to join at the end of this degree. Yeah. So yeah, you'll be qualified both as a graduate sports rehabilitator and as a graduate sports therapist. And this is why we kept both of the titles in the degree name. Okay. Does anybody have any other? Oh, one thing that I forgot to mention, which sometimes comes up as a question, so I thought I'd just mention it. In terms of the amount of hours of placement, this is of course dictated by BASRAT, by the professional body, and by the sports therapy body as well. Is yes, you can do a master's in physiotherapy afterwards. Yeah, absolutely. That's a pre-registration master's, and many of our students do that. Yeah, that's a possibility. We don't offer the master's in physiotherapy, but you know, there are lots of other universities that do. So in terms of placement, under normal circumstances, you would be under non-COVID circumstances, you will be completing 400 hours in your placement. And that means, that sounds like a lot, and that sounds quite daunting. But actually, when you think of it, that is spread over 3 years. So even just going in one afternoon in your towards the end of your first year, and a couple of afternoons in your second year in our own clinic at the university, will already start adding hours to your placement hours. So you're going to be accruing, and we're going to regularly be asking you to submit placement hours throughout your degree, so that you don't end up in your third year and you've only done 50 hours. Yeah, that's what we want to prevent. Mixture of coursework and other types of assessment. Yes, we have only very few summer exams. So a summer exam is something whereby you would sit in a room and answer written questions. Again, in these COVID this COVID environment, all the exams have been online, so they've been a little bit different, and they've been open book. You will have in your first year, your second year, and your third year, you all just have one exam like that, in those kind of where you study and you then answer questions, unseen questions. All the clinical modules, so all the practical modules, always are assessed by a practical assessment and as well as a written assessment. So that would be either a case study, or it would be you putting together an exercise program, or it would be you writing an essay about a particular injury that interests you, and you would do some research. You know, if you've got some experience with ankle injuries or knee or shoulder injuries, or you're quite interested in lower back pain, or whatever it may be. And then, for example, for sports injuries, you would be writing an essay about that. So it's always for the typical sort of sports therapy and rehab modules, you would have a practical component where we need to assess your skills, and you would have a written component. Sometimes the balance between them weighs, well, actually in most of them, it's either 50-50, the weighting, or the practical is 70%, so it's a little bit heavier than the essay. We want to make sure that all of our graduates are, of course, very good at communicating and having a very good writing, having good writing skills, but we also need to make sure that you can actually do the techniques and do them well and adapt. So that's why we have a mixture. Good questions. Yeah, if you fail the first module, will you have to retake? Yes, yes. So again, because if you can imagine doing a history degree, maybe not passing a particular module could be compensated, or you could kind of pick up that knowledge further down the line. If you don't know how to assess a shoulder, then you can't really progress. So we need to make sure that you have all the skills that you need to have in order to become a sports rehabilitator or a sports therapist. So if you fail a component, if you fail, for example, a practical component, you have the opportunity to redo that. And we coach you and we support you in the reset period so that you really understand what went wrong the first time round and how to do that. Now, about this sort of topic, I've been lecturing at the university for 15 years now, and I must say I have never met any student who didn't pass the module and was really surprised and said, but I studied so hard and I practiced so hard and I still fail. Students on the whole do not pass if they didn't attend the modules, if they were not really engaging with the module, because we give you lots and lots of opportunities. So, you know, if you attend and you pay attention and you work together with your peers, we don't test you on things that we didn't teach you. So I think as long as you're there with an open mind and a willingness to learn and to take on feedback, then you know, and I'm a firm believer that anybody can learn these techniques. So far, we have never met or never come across a student whereby we think, it's not really working. And everybody can learn these techniques. How many hours? Okay, so the way that the modules work, they either are 15 credit modules or they're 30 credit modules. And roughly speaking, a typical module would consist of a 1 hour lecture and a 2 hour practical. Some modules consist of a 1 hour lecture and a 1 hour seminar. It depends a little bit. So each term, roughly speaking, you have 3, maximum 4 modules. But of course, that's only your face-to-face. That's only the times when you need to be in the class. You will also need to do work yourself. Independent study is really an important part of being at university. And that's the big difference between studying at university and school or college, where I believe you get a lot more minute or detailed guidance. So we might be saying to you, okay, so next week it's all going to be about the shoulder. Now, that is then an indication for you to go to the library or to use your favorite, you know, if you're a very visual learner, it might be that you want to look at some video clips, or you want to look at some previous recordings, or whatever works for you, that you would then read up about that. So you need to include that in your learning time. So Wednesday afternoon, there's no teaching because we want to keep that free, so that if you are taking part in sports, that you can do that, because that's often when the training or the matches or the games or the fixtures happen for sports teams. We try and you know, group things together, but at the moment we're still working on our timetable. Roughly speaking, it's a full-time degree. You're not going to be in class from 9 to 5, but you will be in most days. More often than not, there'll be maybe one day where you don't have any classes, but most days you will have something, particularly on this degree, because of course you will also have placements. Sorry, it's a really long answer to a very simple question, but I can't put a fixed number on it, because it depends on where your placement is. It depends on a number of factors. And is there any group work? So for the practical components, you always work with another student. So you work in a duo. There are a few group exercises, for example, for anatomy, where we send you, there's like an anatomy treasure hunt or an anatomy quiz or an anatomy, a trail that you need to follow And you do that as a team, you do that as a group. I'm just thinking about your other modules, but there's not a lot of group work. There might be some class-based activities that are done as a group. I don't know if that answers your question. I'm just trying to think. I think because for us, for sports therapy and sports rehab, it's really about working in pairs in the class. And of course, as you get to know, sports therapy and rehab is the kind of degree where you get to know your fellow students really well. And everybody in the class is in the same situation. They won't know anybody else either. This will be a new environment for everybody. So students tend to kind of, group together or go to the library together or meet up after class for a coffee together and then do some work together. Those students that like and need that sort of group support, that peer support, students tend to form that themselves. I don't think it works if we kind of tell students, who to work with. It doesn't work that way. It needs to happen a little bit more naturally. But if there's a problem with a group, then of course we do get involved. Are the classes big? Well, some classes, so for example, your lectures for anatomy, because anatomy is taught to everybody in the school. So you'll be together with sports science students, with sport exercise and health students. So that could be in a lecture room with 100 to 140 students. That's sort of the biggest lectures that we have. The practical classes are really small. So that's maximum 20 students outside, when no COVID at all. And when we have to, look at social distancing and we're only allowed to work with a very small group of people, then you would be in a class of 12. Without COVID, it's a class of 16 or 20. So they're always, we organize the group size according to the kind of feedback that we need to give you. So in some practical classes, you work together. So for example, in rehab, that links back a little bit to group work. So in rehab, you might want to work together in a small group, putting together an exercise program just to practice your skills and get feedback of each other, try different things, and interpret your understanding of the principles of rehab in different ways. And you're going to be putting together and then showcasing your exercise program to the rest of the class, and then the rest of the class will do the same. So that depends. It depends really on what sort of skills you need to learn and how we need to give you feedback. That's how we design. So there's no size fits all. Any other questions? Okay, feel free to add more to the chat. But what I'll do now is, there's a YouTube. Thank you, Amy. Yeah, so you saw, for example, in that little video clip that I showed you where I was demonstrating hamstring stretch and the facilitated quad stretch. You could, I don't know if you saw the sort of feet of the students in the background. That's the sort of size of a class. They're quite small because, of course, we want to give you feedback. Feel free to pop more questions in the chat, as if anything else occurs to you. So what I want to talk to you now is about chronic pain. So our understanding of pain is that it lets us know when there's something wrong. Yeah, when you injure yourself, then of course your brain, your spinal cord sends pain messages and produces pain. And that is a really good alarm system. So here this is just a brief overview of what happens if, for example, you you have a bad tackle in football, or you hurt yourself in whatever activity or whatever sport is happening. And then this, this is sort of a representation of the muscle or the skin. Yeah, and we have lots and lots of nerve endings that feed into this muscle. So if there's any damage here, the pain messages get transmitted really, really quickly through these fibers right here. They end up inside your spinal cord. So this is a tissue, a cord which runs through your spine, and that gets sent. Oops, I keep losing my cursor. And that gets sent all the way, right the way through to the brain. And this is when we realize, ow, really hurt myself. And either the muscle contracts, or there's a whole body movement that pulls you away from the heat or the pain or the danger signal. There are also other fibers, which are these fibers right here. And these are the fibers that transmit pain much more like a dull pain or a burning or a chronic pain. So here, pain messages get transmitted to the brain, but there's not really an injury right there. So why is that? Why would we want to have these two different pain systems? Well, actually, acute pain is really useful because it protects us from danger, and it protects tissues during healing and repair. It stops you from hobbling about on your knee if you have sprained a ligament, for example, or you've damaged your cartilage. So it's really, really useful because it protects us, and it alerts us that something is not right. Chronic pain, or persistent or recurrent pain, actually continues long after these tissues have healed. So your muscle may have healed, your ligaments or your tendons may have healed, but it still hurts. And this occurs, this is a common occurrence. Chronic pain can worsen over time, and it can rewrite the central nervous system, causing changes to the brain and spinal cord. So for us sports therapists and sports rehabilitators, understanding chronic pain is really important. And this is kind of at the cutting edge of pain research. And this is why it's so interesting to work in the field of sports rehabilitation, because there is so much change going on in the way that we understand injury and the way that we understand pain. So why does our brain produce pain when no tissue damage or no injury is present? Well, it's a malfunction of the pain system, of the nervous system. So modern pain science recognizes that chronic pain is complex, and it's not a fixed signal related to a specific amount of tissue damage. So what is it? We may not be able to see pain on medical imaging, such as MRI and X-rays, but pain is always real to the person. So say, for example, 20 or 10 years, in some cases even 5 years ago, students were taught that there is such a thing as psychosomatic pain. Now, psychosomatic pain was understood to be something that this is just something that people were imagining. Now, chronic pain or recurrent pain is not just people imagining things. The pain is real. The experience of the pain is real. So this understanding is very, very different. It's not just seen as a psychological phenomenon. It's something that's real. And it's so much more than signals of danger. And I just want to show you a few bits of understanding of how we make sense of chronic pain. So it's a real result of processing in your nervous system. So it's not just in your head, it's real. The response is unique to each person experiencing the pain. So there is no level of pain which is the same for everybody. It's unique to each person. The one on the bottom left here, there's no single pain center in the brain. That's a really important research finding, because that helped us to understand that pain is mediated by our hormones, it's mediated by our environment, it's mediated by temperature, it's mediated by the health that our body, the health status of our body, it's mediated by so many different factors, how we experience pain. And it can involve lots of different elements as well: nerves, immune cells, memory. So for example, if you've had the same injury in the past, your pain experience of that re-injury is going to be different from your original one, and so on and so forth. Emotions and chemicals, or neurotransmitters, and all of these are unique to every person. Now, the really important thing around chronic pain is that bad news travels fast. I already mentioned neuroplasticity, and I already mentioned that chronic pain can produce changes to the spinal cord and changes to the brain. So somebody with, say, for example, chronic neck pain, chronic shoulder pain, chronic lower back pain, chronic ankle pain, chronic pain can occur anywhere in the body. The nerves connected to that area physically get bigger. So the more pain signals that go through the very slow, the delta neural nerves, the very slow ones, they get physically bigger. So these changes are teaching and are learning this person to transmit those messages. So that's what's meant by neuroplasticity. This is also how we learn things. This is also how we learn how to walk, how to eat, how to basically function as a human being. So this neuroplasticity is something that's very important to us, but sometimes it can be detrimental in the case in the case of chronic pain. So if our brain receives a lot of danger signals, then neurons learn to amplify that danger. So the challenge for us is, what can we do about this? So our brains can amplify pain messages, particularly when there's no injury, there's no damage, but there's still a pain message. So our brain makes these messages louder and louder. But we can unlearn pain. There's not really a single way to unlearn pain, but there are different ways in which we can use exercise and which we can use visual stimuli in order to unlearn, to help the brain to unlearn those pain messages. You may have heard about phantom limb pain. Well, phantom limb pain is pain in an area of the body which is no longer there. So 60 to 80% of amputees, so people with amputation, experience phantom pain. The research that's being done with phantom pain can really teach us how to use this in rehabilitation. So this is something that you're going to be learning about in the course. So treatment for phantom pain is mirror therapy. So you can see this gentleman here sitting on the couch. So he's got one leg here, and this is the amputated side. But you can see in this image right here, he's looking at this mirror. So when he looks in the mirror, his brain sees two legs. Yeah. So he will be suffering from phantom pain. So his brain will be telling him that his foot and his lower leg on his right-hand side is very, very painful, even though it's no longer there. When he teaches his brain to unlearn that pain by visual stimuli, so he's looking and his eyes and his brain is seeing that the two legs are there, even though this leg is the mirror image of that leg, it actually unlearns his brain about pain messages, and phantom limb pain reduces, and it reduces in about 75% of people. With some people, it works immediately. With other people, they need to have a few treatments. This gentleman right here, see, he's looking in the mirror. He is a hand and wrist amputee. So he's looking in the mirror right here, and he sees his hand, his left hand, and he sees a mirror image of that left hand, and his brain thinks that this is his right hand. So his brain again is looking at his hands and sees that there's nothing missing, and this unlearns his brain to experience phantom pain. Similar to mirror therapy, we can use movements as a treatment for chronic pain. So we can use pain-free movements in order to train the brain to unlearn this pain. We can use mirror therapy as well in sports rehabilitation. So finding ways to move or to exercise without fear, without moving differently, to retrain the brain is a really a very new method to use sports rehabilitation. Visualizing pain-free movement can really activate the brain and can stop that neuroplasticity and can quieten those pain messages. So each movement a chronic pain patient makes and experiences as safe will help to retrain the nervous system. So really the whole idea about chronic pain and neuroplasticity is that it's a new concept to treat chronic pain. Exercising the brain with a variety of movement and actions and challenges to desensitize the central nervous system. And pain-free movement can turn down that pain volume. So we can use rehabilitation not just to help somebody with their ankle sprain, not just to help somebody with a dislocated shoulder. We can do those things, but you can do so much more with sports rehab. So chronic pain is one of those areas in which you can use or we are all using exercise in order to treat people. So chronic pain involves a sensitized nervous system. So our understanding of chronic pain has changed in that we now understand that it's not just in people's heads, but that it's a real change within the nervous system. And chronic pain is so much more than problems in the tissues, because there is the damage that occurred maybe many years ago or a long time ago has healed a long time ago, yet the pain is still present. And you can train the brain to reduce or to switch off that pain through pain-free movement and exercise. Here are some resources if you're interested in this area around pain education. Butler wrote a book called Explain Pain, and this is written for the general public. It's written for therapists, and it's also written for people who experience chronic pain. So it's really useful. This website right here, the Pain Toolkit, is developed by somebody who experienced a chronic pain himself, yet found it very difficult to find the right treatment. So he's developed a toolkit to teach practitioners such as sports rehabilitators, physiotherapists, osteopaths, and doctors in how to understand chronic pains. That's really, really useful resource. And then Tame the Beast is a website by Professor Lorimer Moseley from Australia, and he is one of the foremost researchers and practitioners in using exercise to treat chronic pain. And that has a lot of video clips which are aimed both at children, adolescents, older people, and therapists. And this is again an example of the kind of, you know, when somebody earlier asked, well, how many hours do we have? Yes, you have, you know, you may have, for example, an hour lecture on chronic pain, and you may have an exercise that you need to do, but then there are all these other resources out there, depending on where your interest lies, that then we encourage you to explore. And that's really how you get the most out of your degree. So thank you very much for listening. We hope to see you in 2022. And we don't just eat fish and chips on the beach, but I thought it was quite, you know, a nice picture of the students who are actually graduating, who have graduated this year. So yeah, it's just also to remind myself that the 3 years that hopefully, if you come and study with us, go really, really fast. So yeah, make the most of it. And this is two handles where you can follow us. This is Unikent Sports Sci on Facebook or Instagram or Twitter, and SRC stands for Sports Ready Clinic in Kent. So that's the handle for our clinic.